Hey everyone, welcome back to Graft Academy. Today we're answering one of the most important and sometimes worrying questions. What causes a bone graft to fail, and how can you avoid it? First, let's clear something up. Bone graft failure is not common. When a graft is done correctly and the patient follows instructions, success rates are extremely high, usually over 95%. Still, knowing what can go wrong helps you protect your results and heal with confidence. Let's break down what failure actually means. A bone graft fails when the body doesn't replace the graft material with living bone. Instead of integrating, the graft might remain soft, partially resorb, or become infected. In rare cases, the graft can become exposed through the gum tissue or fail to form the strong structure needed for an implant. There are three main categories of causes: surgical factors, biological factors, and patient-related factors. First, surgical factors. This includes anything that disrupts the graft's stability or blood supply. A bone graft needs to stay perfectly still and well oxygenated. If it moves or if there's too much tension on the gum tissue covering it, blood flow can be reduced. Without oxygen and nutrients, the graft material can't convert into new bone. Inexperienced technique, poor flap closure, or contamination during surgery can also lead to early complications. That's why sterile conditions and precise handling are critical, and why bone grafts should always be placed by a trained professional who understands soft tissue management. Second, biological factors. Every body heals differently. Systemic health issues like uncontrolled diabetes, anemia, autoimmune disease, or vitamin D deficiency can slow healing and reduce bone regeneration. Certain medications like long-term steroids or bisphosphonates also affect bone turnover. Even something as simple as chronic stress or lack of sleep can weaken your immune response. When healing is delayed, bacteria have more opportunity to interfere, increasing the risk of graft loss. Third, patient-related factors. This is where most preventable failures occur. Smoking is the number one risk factor. Nicotine restricts blood flow and reduces oxygen to the graft site. Without oxygen, bone cells can't survive, and the graft can break down before it integrates. Poor oral hygiene is another big cause. If plaque builds up near the surgical site, it creates a breeding ground for infection that can spread under the gum line. Ignoring post-operative instructions, like eating hard foods too soon or touching the site, can also dislodge or contaminate the graft. Let's go over some early warning signs that may indicate a graft isn't healing properly. Persistent or increasing pain after the first week. Swelling that returns or worsens instead of improving. Gum tissue that opens, exposing the graft material. A bad taste, odor, or drainage of pus. These are all signs to contact your dentist right away. Most issues can be resolved easily if caught early. Now let's talk about how to avoid graft failure. Here are the key steps that make the biggest difference. Follow all post-op instructions carefully. Take medications as prescribed, avoid disturbing the graft, and attend all follow-up appointments. Your dentist will monitor healing and make adjustments if needed. Keep your mouth clean, but gentle. Use recommended rinses, avoid aggressive brushing near the graft, and maintain overall hygiene to prevent bacterial buildup. Avoid smoking and alcohol. Both reduce oxygen delivery and slow healing dramatically. Even temporary abstinence before and after surgery improves outcomes. Eat a healthy, nutrient-rich diet. Your body needs protein, calcium, and vitamin D to build bone. Stay hydrated and rest well. Bone grows best when your body is balanced and healthy. Report any unusual symptoms early. If you suspect something isn't right, don't wait for your next appointment. A quick exam or X-ray can confirm whether the graft is stable and healing correctly. In rare cases where a graft doesn't integrate, your dentist can perform a revision procedure. This usually involves cleaning the site, adding new graft material, and sometimes using PRF or growth factors to improve healing. Most patients who experience a partial failure go on to heal successfully with a second attempt. To summarize, bone graft failure is rare and usually preventable. The biggest causes are poor blood supply, infection, movement, and lifestyle factors like smoking. You can avoid them by following instructions, maintaining great hygiene, and supporting your body's natural healing. When done correctly and cared for properly, a bone graft becomes part of your body, living bone that's just as strong as the original. Patience and consistency are what make the difference between a short-term fix and a long-term success. If you found this video helpful, make sure to like it, Subscribe to Bone Graft Academy and share it with someone preparing for dental implant surgery. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.